Good evening, everyone. Can everybody hear me? Can I get a thumbs up from Ivy or Jaziel? Great. We're gonna people are coming into the room right now, the Zoom room, and I'm gonna give it just a minute for folks to get in, and then we'll get started here very shortly. All right, I'm going to go ahead and get us started. I'm Chip Denton, the head of school, and really welcome all of you who are participating. I want to give a special thanks to our panel, and they'll introduce themselves very shortly here. Want to thank for all of you for coming together for this chance for us to sort of look back and take stock of where we've come. We're coming up on the 2-year anniversary, hard to believe, of COVID in the Trinity School community back in March 13th, 2020. When we first made a decision to go remote, and here we are almost 2 years ahead. We want to look at where we are, and we'd like to begin to help the community think about moving forward into this next phase. And it's going to be a little different than in the past, maybe a lot different. And we want to begin as a community to think about that and talk a little bit about new protocols, look ahead at things that will come, and most importantly, take your questions. So many of you have submitted questions. Thank you very much. And we are going to spend some of our time addressing those. There is an opportunity for you to give live questions in the Q&A function there. And if you'll put those in, we will feed those to the panelists. And I will say, especially in light of the governor's announcement this afternoon, and we're going to say a bit about that in a minute, that the live questions may be especially important because a number of the questions that were submitted ahead of time were written before that announcement. Almost all of them were, and maybe made some assumptions that now things have changed a little bit. So feel free to send those live questions in, and we'll get to as many as we can. So with that, just a couple other things. We are recording this session, and we'll hope to be able to share that out with others. Also, really am thankful for the professionals, the medical professionals who are on this panel tonight. I just want to say that they are representing themselves and their own views, and they're not necessarily representing their employers. And we come as different professionals with our own perspectives. Yeah, with that, I'm going to ask that the panel introduce themselves. Adia, if you would start.
Hi, good evening. My name is Adia Ross, and I'm the Chief Medical Officer at Duke Regional Hospital. I'm an internist by training and a hospitalist. And you may ask, why am I on this panel if I'm not a pediatrician? But in my role as a CMO, I have been a spokesperson for Duke Health and done over 40 media appearances related to questions around COVID, vaccines, other things. I also have been one of the medical directors of several of our COVID vaccine clinics. And I also serve to oversee our infection prevention team at Duke Regional. And I'm here just to try to provide some light and understanding about some of the perspectives we may want to consider as we go forward, and just to support you guys.
Thanks, Adia. Ivy.
Hi, I'm Ivy Pointer. I am a parent of 3 kids at Trinity and also a pediatric critical care doctor at WakeMed. So I have been taking care of kids with COVID, and will be happy to speak about that and my experience with that in the hospital.
Great. Dr. Hall.
Hi, I'm Matt Hall. I'm the middle school director at Trinity. I've been middle school director for 6 years, also the parent of 2 Trinity alums, and I have a PhD in biochemistry, and the focus of my thesis work and my dissertation work when I was in graduate school was on the biochemistry of viruses.
Thanks. And Dr. Garges.
Hi, everyone. It's Harmony Garges. I am an alumni parent. I had 2 children that graduated from Trinity who were there starting in the 1st or the 3rd grade. So we spent a number of years on the Trinity campus. I'm currently a board member I'm a pediatric infectious disease clinician, spent about 15 years at Duke as part of my training and practice. And I'm currently now Chief Medical Officer for ViiV Healthcare, which is a company that's actually focused on HIV, not COVID, but given my background in pediatric infectious diseases, Chip asked me to participate. So really looking forward to this conversation with all of you.
Thanks, Harmony. And I think you know Jez McIntosh, our associate head of school, and I will also be taking some of the questions. So let's, we have a few slides we'd like to run through at the beginning to frame this, and then we'll move right into the questions. So if we could forward to the next slide, that'd be great. I'm going to ask Mr. McIntosh if he would sort of look back, and Jez got here in the spring of 2020, and we said, welcome to Trinity. You're in charge of the Nerve Center, which is going to manage this this COVID thing.
Yes, it was quite the introduction to Trinity. Good evening, everyone. I actually officially took my role in June of 2020, but because everything shut down and went remote, I was able to sit in on meetings in March of 2020 when Trinity decided, as Dr. Denton said, March 13th to go remote. And our teachers did a wonderful job transitioning from in-person instruction to fully remote. And as it said, you were trying to figure out how many weeks it was going to be, and turned out it was the rest of the semester. And what we learned from that short time was, our mission was better served in person. And so when I did start in the summer of 2020, as Dr. Denton said, I was in charge of the Nerve Center, and with a group of fellow administrators, we really prioritized how can we get back in person, because it was about the mission of Trinity was best delivered in person. And so we worked, we measured, we worked, and we were able to open up. We offered remote options for families who chose that. And we prioritized in-person learning, and we also prioritized the safety of our students. And so if you remember, this was 6 feet, masking, we had cohorts, no visitors, limited sports. All of this was trying to ensure that we could stay in person. And so for the first year, we had only 14 cases for that entire 2021 school year. And so going into this school year, we were optimistic. We had most of the layers continuing. We went from 6 feet down to 3 feet. Still prioritizing in-person learning. We were hopeful that the vaccine was going to come earlier than it did, and that we would get to a more normal school year. And we opened up that way, and then Delta hit. And so we went back to masking outside and inside. And then, as you know, Omicron hit in January, and our numbers rose significantly. So speaking of the numbers, I'm just going to overview kind of our numbers on campus since the start of the pandemic. So as I mentioned, in 2021, we had 14 cases the entire year. And so we started this school year, and from August to winter break, we saw only 14 cases as well. And then as winter break started, we saw the increase of Omicron and the effects of Omicron on our community. And you can see that since January of 2022, we've had 121 cases within our community and in faculty, staff, and students. And so with that, we've seen a shift in the pandemic, in the protocols, and all of this has, we've been nimble in trying to react and trying to put things in place to help us, again, stay in person. So what's different now than when we started back in August of 2020? First, vaccines are available for all Trinity students and staff. And you can see our vaccination rates there on the screen. The governor's announcement today, they said the best way to combat this disease and virus is with vaccinations. And so we are encouraged that everybody has access to the vaccine, and we hope that more will choose to get vaccinated in the coming days and weeks. So that's one thing that's different. The next thing that's different is Omicron. Omicron kind of turned things around in a lot of respects. One, it was highly transmissible. And so it was less tied to distancing and masking. It was just very transmissible. And so most of our protocols and our current playbook was built for the original strain or Delta. And so Omicron, we have found, produces different outcomes. And so there's been a shifting in how we have managed this, or how we've been advised to manage this, the pandemic, because of Omicron. And so Dr. Denton's going to talk about those kind of changes and where we're at.
Before I do, Jazz, do you want to take one of the questions that just came in was, do the numbers reflect only students or also faculty and staff?
Those are faculty and staff and students.
Yeah, thanks, Jez. So, what Jez began to talk about in those last two slides was a shifting of perspective. And I think I just want to mark that, okay? I think it's not a pivoting on a dime, but it is a turning of Trinity. I think over the last month or so, we've begun, and even before that, anticipating this might well happen, begun to think about how we need to develop strategies that adjust, that are appropriate for 2022, that not strategies that we needed in August of 2020. We need, and some of the things that Jez was talking about, I'm going to mention a couple of others. This one is really important. The costs, I think an increasing understanding that the costs of mitigation are becoming clearer. And this is so important. Those costs have always been there, and some of them have increased with time. The longer we have done the mitigation strategies, some of them have cost us more. At the beginning, and back, if we go all the way back to August of 2020, I think some of those costs we had some sense of, but we thought these are costs that we need to pay these in order to stay in school and stay safe, stay in person. But they have taken their toll, and we want to recognize that. I think part of our posture as a school is to recognize that this pandemic there have been losses. We need to name those. There have been hard things. Trinity has probably lost less than a number of schools, and for that we're thankful. We have been, one thing is we've been able to stay in person in school for such a long time, for these 2 school years, and I don't take that for granted. And yet there are some impacts, and student mental health is one of them. And you'll see some things here that are noted in the literature. This is from the Journal of the American Medical Association, the Pediatrics Journal, that just children and adolescent mental health is a rising concern. It was something that was on our radar before the pandemic, but the pandemic, I think, accelerated things and probably exacerbated some things. If we could go to the next slide. This is from a Surgeon General report that came out in December. And, I think it's worth just noting his warning here that as we move into a different phase of the pandemic, there is this other challenge, this other mental health challenge that we need to recognize. And that for individuals, for families, communities, and spreading outward. And Trinity wants increasingly to pay attention to this. This is probably a good point for me to say that I do regret. Some people had emailed and asked, why do we not have a mental health professional on the panel tonight? And that was a miss on our part. I'll take responsibility for that, and was able to communicate with some of our mental health professionals in the Trinity community. And here's something that they communicated to me. And we are working on some ways in which we can connect parents with mental health professionals, perhaps with an additional panel involving some of these professionals, certainly providing resources. At the end with the last slide, I have some resources for you to look at. But I think this is worth noting here, just to note that that the lack of connection has been very hard. That community factor at Trinity is one of the things that has helped us all manage. It helps us manage stresses and hard things in our lives. And so when we aren't able to connect in the ways that we are used to, this creates challenges. And it's something to name on the part. It's not just for students too, it's for faculty and staff and for parents. We know that parents are feeling disconnected. There are parents who have been at Trinity for this is their first year or their second year, and they haven't experienced a normal Trinity where you can come onto campus and go to an all-school chapel or be part of a parent gathering for fairy tale day or whatever it is. And just want to name those things. And I think we as a community need to begin to think more and more about how we can make decisions that will move us in a different direction, a holistic view of well-being, not just physical health, but mental, spiritual, emotional health as well. So this is a slide just to think about, as we think about risk, we think on two axes. One is about probability and one is about impact. And as we move into Omicron and this post-Omicron phase, we'll probably be thinking about the risks of COVID in a different kind of way, that it may be perhaps, we've seen with Omicron, it is more probable that people at Trinity will get Omicron, but the impact has been less in certain kinds of ways. And we're going to talk some more about that in specific ways. So recent changes that we've made with these pivots, we've gone starting this week to optional masking outdoors, including athletics that started, the spring sports that started this week. We're not policing social distancing with students outdoors, which I think is one particular way of addressing some of the mental health concerns, because I know that the freedom of students to be able to play and to interact in ways that are natural is really important to their mental health. And discontinuing the Ascend app, and instead, that slide got cut off, but instead moving to a moving to a symptoms-based approach. We'll say more about that too. Next slide, please. These are decisions that are before us. Optional masking indoors, when we move to that, we'll talk a lot more about that, I'll bet. The governor talked some about that today. Returning to some field trips, parent gatherings on campus, increasing the size of our school gatherings, worship, cornerstone, assemblies, and those sorts of things, parent meetings. So I did want to have this one slide in here, just acknowledging what the governor communicated today, in case you hadn't heard this, that with improving trends, the anticipation that on March the 7th, the state will give a new guidance in the toolkit that we have been using to guide Trinity since the summer of 2020, that will emphasize three things: promoting vaccinations for students and staff, participating in school testing program, we can say more about that, and especially consider moving to voluntary masking at the discretion of local authorities, as universal masking is a less important tool in lower risk settings like schools. So we are waiting on Durham County to announce its response to the governor's encouragement to adjust local mandates, and I'm sure we'll be talking more about that tonight. With that, I'm going to turn it over to Adia Ross with the first question the evening, which is why so many different approaches across the country and even across the state, Adia, to COVID that we've seen. I know that's been baffling and puzzling to our parents and to many of us.
Thank you. First, I want to just say, as a parent, just thank you guys for everything you've done. I mean, when you hear all the things that you've done, and just as a healthcare professional and thinking about how hard it's been the last 2 years and knowing that my child was safe at Trinity and all the thoughtfulness that went into everything. So I just want to say thank you, because I know it has been difficult for you guys, and trying to balance all of the needs has been very difficult. And just want to say thank you to the Nerve Center for the thoughtful approach that you guys have taken, and for helping all of us be able to still work, because I think that's a privilege. Not many people have had major disruptions to the economy in their lives because they couldn't work because their kids were in and out of school. So I just want to say thank you for that. The first thing, Jez, if you want to kind of put the slide up, yes, is one of the things that is interesting to me, and just as a healthcare professional, and also I saw this headline from ABC on Monday, and it was like nearly a dozen states moved to end masking mandates. And I was like, what does that mean? And so I went and actually read the article, and I encourage you to kind of look through it. And it just seemed like there was a wide variety of approaches, right? So California was like, oh, you hear initially, you're like, oh, they're getting rid of universal mandates. And it could have changed between now and the other day, but they were still doing stuff with, they still were saying indoor masking for schools was going to remain in place. Or Massachusetts is like, yeah, we're going to remove the masking mandate for schools, but that's because we have one of the highest vaccination rates in the country for children. And it's just, and then a lot of them are like, well, we're going to start with the indoor masking and, other places, restaurants, but it's still in healthcare facilities, and we're waiting to see if hospitalizations drop. And so there's just such a wide variety of approaches, and I'm hoping to really kind of shed some light as to what those data elements are, and some of the data that we have about schools in particular that I think has made people want to pause and balance some of those things that Chip talked about. Next slide, please. So when I think about this, and when I saw that article, the first thing I thought about was an iceberg, right? Where it's like you got the tip of the iceberg, you hear one thing, but there's actually a lot of stuff underneath it. And so I wanted to kind of break that down a little bit and say, there's this urgency to return to normal. You see the headlines, governors lifting universal masking, school districts. But then when you look a little bit behind it, why are people being incremental? What are they looking at? They're looking at local hospitalization rates. They're looking at vaccination rates in schools and within their community, and they're looking at the data about their own data around local school transmission rates and trying to make the best decision they can. Next slide, please. I really thought about this, and I thought about this a lot. And even as a healthcare professional, we love to solve problems. We love to come and diagnose you and say, I know what you got, and be able to fix that. But this is one of those things where it really, is the pandemic a problem to solve, or is it something that we're going to have to manage? And is that really modulating people's approaches? Because if it's something that you have to manage, we can't have either or thinking. And I think of this, this illusion where it's like, okay, we either got to have everybody masked all the time, or we got to go maskless, right? And people can get kind of stuck in that. And if you look at this picture, it's like, if you said, okay, well, what does this picture show? Some people see a vase, other people see two faces. Both of them are actually correct. And you can't really say that the approach or the picture is complete without acknowledging both. So I really think, what's behind a lot of this is that people are doing the best that they can. And I think they're really trying to answer the questions that Chip Tannen talked about. How can we create short-term and long-term COVID measures that are driven by data that's current, right? And what we know and we're learning, and recognize the need to have some semblance of pre-pandemic life. The other one that I think many of us talk about is how do we balance the physical health of our children with the mental health of our children? And there has to be a balance. And sometimes I think it's throughout the pandemic, to get to that next level, sometimes you have to swing one way and then the other way, and then we have to come back and balance. And I think that's what we're trying to do, and thinking about what the governor put out. I think and listening to the Secretary of Health today, that's what I think they're thinking about. I wanted to point you guys to the ABC Science Collaborative. I encourage you as parents to Google this. This is a non-partisan, a collaborative between Duke and UNC and several other professionals, mainly pediatricians, that have been advising school districts and governments about, and really trying to look at the data to say, what do we need to do in schools? And so these are some of the things that they've really said. Number one is, as a group, they are not in the business of telling people whether they should mask or unmask. That's not what they're trying to accomplish. What they're trying to accomplish is to say, here are some things that you should consider when you're trying to decide what you want to do. And I think these things really are important questions that, as professionals, as parents, we need to be asking, and as the community. So the couple things that they say are really important. And I will put the link to the ABC. Thank you very much, Carmen, for putting that link in there. What is the potential, can you go back? Just want to go through these briefly. What is the potential quantifiable implications of the decision on within school transmission of COVID? And how does that affect with the transmission for the school to the community at large? The other question they want to ask people, do all the members in your community have access to safe and effective vaccines? What do we know? I thought this one was really important. Do the vaccines and medicines that prevent severe disease for the current pathogen and variant, right? And that nuance there is probably why people are saying, okay, maybe we need to take a step back. And what is that rate of, and the illness and death compared to other things? And then the other things that people want to know is the rate of community transmission and anticipated increase in community transmission such that critical institutions, hospitals and schools can function with normal services and staffing? You have to think about that, because, for us in the hospitals, when the community infection rates were high, our people were getting sick or their kids were getting sick, and that was causing our ability to provide services to their community. It really put a hamper on that, because it wasn't just about them being ill, but they had to take care of their family members. That put a strain. The other thing is it important? It's important to recognize, you know, how can we be incremental? How can we think about the children's development and how we roll these things back and thinking about how we prepare them, and really challenging schools and the government to say we need to focus on social emotional learning and think about that curriculum. And then another one that I think I just took is really saying, all right, guys, you guys need to continue to be flexible. Is there a plan and ability to adapt and reinstate safety strategies to preserve in-person education if the pandemic changes? Next slide. I will tell you that the ABC Collaborative, one of the reasons I really think I really like their data is they really challenge in the United States to say we need to get people in school. And it is important, take that off the table, that community rates really shouldn't affect whether they are where their learning occurs in person. What it should affect is your COVID mitigation strategies. And so, you know, just want to point that out. And I encourage you to look through their videos because it's very educational. There's a lot of really good fact sheets. Just want to put this up here too, comparing North Carolina's on the left and Durham is on the right. And when you look at this may be why there was some pause. You can see how high, so the right side shows you the total number of cases, and this is based on PCR data. They publish this once a week this is all publicly reported. And if anybody wants the link after I finish, I can put it in the chat so you can follow it along yourself. But this is based on PCR samples. This does not include, you know, the in-home antigen tests or others. So it could be higher. And so you could understand why there was some pause initially to say, even though it's coming down, it was so high compared to even the other places, why people want to take a step back and say, okay, is this the right time? What do we have for our mitigation strategies? And how do we really think about this? And then you can see deaths. I mean, our deaths, thank the Lord that deaths are a lot lower, but you can see there was a spike in the last couple of weeks. And so those are the things that I think people are working through. Next slide. This is again, just showing you, and we'll keep going through this, but this is just to let you know that there is information you can track the amount of vaccinations. And I think the governor talked a little bit about that. So I won't belabor that point. Next slide. So one of the things I wanted to point out, which I thought this was very interesting, and again, you can go to the ABC Collaborative, download their paper, look at their evidence, look at all the things there. So one of the things that they did is they've done studies and tried to collate all of the studies that a lot of the studies have been done in school districts across the country to really see what is the in-rate transmission of COVID at school. So I'm just going to give a couple definitions, and we're not going to spend a lot of time on these, but again, they looked at, you can see these populations are really just school district children that participate in these. So these are different studies, different parts of the periods of time, but they just basically showed when you think about a school and infections, you have primary infections. So how many people are infected with COVID and they're bringing it to school? And then secondarily, when they get to school and they have an infection, if back when we could do contact tracing before Omicron and people could actually look at that, how many infections could you really attribute to being in school? And what they found with masking in general, that the transmission, number one, in schools was very low if people were masked. And it would actually take, and even with all these studies, if you look at this ratio, primary to secondary cases, it takes about 20 to 25 people to come in the school with COVID to infect one person. And so that was one of the things that people were saying, okay, well, that maybe really speaks to masks being very effective. Now, of course, you got to think about what is the rate in the community and what is the risk, right, that you're willing to tolerate. And what about the variant lets us know whether that risk is going to put other people at harm's way, the children at harm's way. But it's just something to say that really masking can be effective. The other part of this slide, which was interesting, was that they went and said, okay, we need to have a control group. So what they did is they went to all these districts. They had some districts that were like, we're going to universally mask, some that were variable masking, meaning they started out unmasked, and then they had a whole bunch of transmission, and then they started masking again, and then those that were voluntarily masking. The key here to show is that, and this is again, data that we need to use in the context of what our community rates are, but if you can see here, if they're totally unmasked, they basically were saying, how many cases do you have to have within the school primary cases where people are walking in with COVID to actually say that you're transmitting it to students? If they're unmasked, it takes about 145 cases. If they're partially masked, it could take about 305 to get to over 30. And if people are fully masked, you can see this rate. And so the rate of transmission really went down. And I think part of this to also recognize, and people may know this, but now, you know, the CDC has changed the guidelines and the quarantine period, if you're vaccinated or if you have symptoms of COVID. And now after day 6, instead of day 10, you can come back to work, but based on the fact that still, and they ask people to still mask because a third of people are still infectious with COVID between day 6 and day 10. And so that's something that is a fact that they've really found across. And that's why still the governor today, if you go back and look at it, he said, yes, we support districts going to voluntary masking, but people who are still, if you have COVID, you still need to mask. If you potentially been exposed to COVID, you still need to mask. And if you're not fully vaccinated, your risk is still high. And so I wanted to just put that in there because that is another reason why I think you may see this graduated kind of incremental approach where we may go to partial masking and we may not go just totally unmasked because of that. Next slide. And this is our conclusion kind of slide. I just want to say community transmission rates, vaccination rates have an impact on an in-school transmission rates. And this is modulated by indoor masking. And we talked a little bit about the fact that a third of people between day 6 and 10 are still infectious. And that's another reason why hospitals started using voluntary N95s when people would come back to work because of that issue. And then you want to take an approach that looks at the factors to decide the timing and which measures need to be rolled back and important. And then I think the key is for us to all remain flexible. I mean, there are many of us that are on a spectrum. Some of us that would be fine to have our kids masked for forever and other people that are ready. But I think, remaining flexible and understanding that this is a dynamic situation and that flexibility or why people are pivoting all over the place is because they're looking at their individual situations. And so, I think that gives gives validity to the approach that Trinity has taken where they're looking at their own data, looking at the community transmission and trying to decide what's best to do.
Thank you. Thank you, Dr. Ross. And I think what we're going to do at this point, I'm actually going to call an audible here and go to some of the live questions, which I think are coming in. And let's start with those, at least some of them. And we'll try to move quickly through some of them. But one of the questions was about why schools are considered low risk. Can maybe Dr. Garges or Ivy or Matt Hall, can you speak to that?
Hey, Chip, it's Harmony. I'm happy to get started and then would welcome input from my fellow panelists as well. I'm not sure if Cooper referenced any one study in particular during his conference today. I wasn't able to hear the actual verbatim conference, but there have been a number of studies that have come out over the last 2 years looking at environments that are higher risk versus lower risk. And what has been seen consistently across those studies is there are certain indoor environments that are higher risk. Certainly indoor is higher risk than outdoor environment, and density plays a role in this too. So if you're indoor in a highly dense environment, that's going to be a higher risk than if you're indoor in a lower density requirement or environment. And then some of it is of course linked to what activities people are doing. So we know certain activities like singing, those kind of things are going to be higher risk environments than if you're just sitting quietly, silently on your own. So there's several different studies. We could probably circulate them again, Chip, after this program tonight. But there have been several studies over the years looking at the kind of environments and those that have a higher risk of transmission versus others. And again, I'm happy if other colleagues want to say more about that.
That's helpful, Harmony. Thank you. Any other? Let's go to the next. One of the questions is basically, we cited the JAMA study. Have we seen, do we have any evidence that students at Trinity are having mental health issues that are associated with COVID? Do we want to, Dr. Hall, Mr. McIntosh, Ivy, you're a parent, you see people in the hospital. Can any of you all speak to that?
So, I think we've seen some evidence that some students are struggling more than others. I think that it's hard to know at school sometimes when we see the things that we see. We try hard to get to the bottom of whether it is related to COVID or if it's related to something else. Students have lots of issues that can make them struggle at times. I think we've tried to make efforts to make the school day as available to them to do the kind of social things that they'd like to do and interact with one another. We've had to make adjustments as we've gone in order to be safe, but we've also tried to do things where we can to provide opportunities for them to be outside together, especially with their masks off, being able to interact, provide as many normal kinds of activities as we can. In middle school, the Turkey Bowl was something that we thought was very important and tried to do that for our students and found a way to do that that we thought was relatively safe. It wasn't exactly the same as what we'd have done if we didn't have COVID, but it was as close as we would get to it. And I think we've looked for opportunities to that. And we've also tried to sort of focus on the idea that being together at school is an important social part of their development and helping them to have as much of a normal interaction when they're here as we can. And the faculty have been mindful to watch. And whenever we see something we're not sure about, we talk to counselors and parents and try to understand it better.
Thanks, Dr. Hall.
I could speak to just the
Yeah.
mental health challenges we've seen kind of across the area, maybe not specific to Trinity, but you have to remember that all students are experiencing the stresses of pandemic life, whether that's being out of school for some students or whether it's things are just not the same as they used to be. And so I think those stresses, I don't think Trinity's immune to those stresses. And certainly in the hospital, we have seen dramatic increases in patients having to be admitted for suicidality, depression, anxiety. We've also seen kind of the worst cases I've seen in my entire career of attempts, students just kind of really feeling like they're at the end of the line. So to me, the mental health challenges have been a huge part of the pandemic for pediatric patients. When we were not seeing many admissions early on in the pandemic for COVID, where the adult hospital was really busy, we were only seeing mental health. And so I think it's definitely something that we have to take into account here.
Yeah. And we certainly, have anecdotes. Certainly parents, communicate to us about students that are challenged with wearing masks or not being able to see the faces of their students and things. So it's, one of the questions was about natural immunity. Could one of the doctors jump in on this? Like, why is natural immunity not being considered? And as we think about, the overall immunity rate in the community.
Chip, I'm happy to start again and we'll look to colleagues. I'm not quite sure what the real question is around natural immunity. I think what's fair to say is for something like a coronavirus, which is a respiratory virus that you can contract multiple times, like RSV or influenza, natural immunity doesn't provide you complete protection to actually never catch it again. Just like your vaccines don't actually protect you from contracting the disease, they protect you from severe consequences of contracting the disease. So, again, just at a high level from strictly an infectious disease level, natural immunity is great. You definitely build antibodies, you will protect yourself for a bit of time, but that's not a guarantee that you won't ever have coronavirus again. And we have certainly seen people who have already just in the 2 years of the pandemic come down with COVID multiple times. And I know someone personally who had COVID, then they got vaccinated and now they've gotten COVID post-vaccination. So again, it's just to say natural immunity or vaccine-induced immunity is not a guarantee that you will not get infected. It's just a mitigation factor against severe disease and death.
Thanks, Harmony. I think, are there any other comments? I'm going to move on to another question. I think one of the questions that was submitted ahead of time, a couple of them, I'm going to yoke them together and ask maybe Ivy and Adia if you would address these. What are you all seeing in terms of young COVID positive children who've been vaccinated versus children who are not vaccinated? Just what are the differences that you're seeing in clinic and hospitals?
So I'll start. Like I said, I work in the ICU. And so I've been there throughout the pandemic, and we've definitely, people want to say, well, kids don't get that sick with COVID. COVID's not that dangerous. Well, the reality is COVID is killing kids. And it is one of the top 10 causes of death for pediatric patients. Kids don't die of very many things. So yes, it's rare, but that's because it's rare that kids die. And so we've had kids die at WakeMed. We've sent kids to UNC that have died. We've taken care of about 50 MISC patients, which is the post infection inflammatory condition that causes a myocarditis and inflammation in the heart. It can be pretty scary for parents to witness their child, having to be on vasopressor medications in an ICU. And of all those patients, of all of the acute respiratory COVID patients, of all the MISC patients, there has only been one vaccinated patient, and it was a mild MISC case that did not make it to the ICU. I've also seen COVID present with neurologic changes, a couple kids that have had seizures and altered mental status, and they are altered for days. There's case reports of kids dying from this. And I can tell you those parents at the bedside in those moments wish they had vaccinated their child. So, I think as a pediatrician, my passion is child health advocacy, and vaccines have always been at the top of that priorities for children's health. And so I think this is just one other opportunity where we can protect our kids. And if you have questions about vaccines, I'd encourage you to look to your pediatrician. Don't look to the news. Don't look to Google. Talk to your trusted pediatrician, because they'll have the best advice. My kids had COVID a few weeks back, and I was in the ICU with a bunch of patients with COVID. And I can assure you that the 12 hours my kids had a sniffly nose was nothing compared to what the other families were going through. So.
Thanks. Dr. Hall, I'd like to ask you, we had questions submitted ahead of time. Just what are the exhibited symptoms for which a student would be sent home? I think these are questions about our new protocols that we're not using the Ascend anymore. Are all symptoms grounds for, a PCR test to return? Can you speak to that very practical question that parents have?
So I think the reason for what we wrote was because we're not doing Ascend, we want to continue with our culture where when your children are sick or might be sick, we want them to stay home. That's something that COVID has brought us that is a good thing. The idea that if you're uncertain about your child's health, that you keep them at home and talk to the doctor about that. And so the symptoms that we're looking for are COVID symptoms. Certainly fever is something that would result in your child having to go home. Cough, the things that are consistent with what would be, we're not going to send them home for a sneezing or sniffles. We do notice, though, with Omicron, a change where students who would only have one symptom with the Ascend app would test positive subsequently for Omicron. That wasn't something that we were seeing very often with Delta or the others. It usually would be 2 symptoms or more on Ascend before the student would likely test positive. So I know that it seems a little bit difficult to ask for PCR tests. We like PCR tests in that they give us the best sense of if a student is really infected. The antigen tests are a little bit harder, and they're prone to parents doing them well, as opposed to a lab doing them. Now, I think the newest toolkit is now allowing us to look at antigen tests more. And so we're willing to consider those things. We don't mean in this sort of communication to say that any symptom will get your child sent home. We just want to be sure that you're looking every morning and evaluating whether your son or daughter seems sick. If they do seem sick, please keep them home. If they come to school and we think that they have symptoms that are consistent with something that might be COVID, out of an abundance of caution, we're going to ask that they go home, just like we did previously. Our goal is to try to continue with a community emphasis on health and keeping sick kids at home.
Thanks, Dr. Hall. Here's a question. Given the effectiveness of N95 masks, doesn't it seem reasonable to allow those who desire protection to protect themselves and others and to not be held to wearing the more ineffective masks? Does anyone want to tackle that one?
Chip, it's Harmony. Hey, Julie, thanks for the question. Although I'm I'm not sure if I understand it. Are you just asking if we are in a mask optional environment? What are the different choices versus if you're in a mask mandate environment? If you can type in, Julie, just clarification to that question, just so we're making sure we're addressing it correctly.
Okay. Why don't we wait on letting the questioner clarify that question? We did have a question about, was there any benchmarking? Have we compared Trinity's transmission numbers with other comparable schools in the area that have been mask optional this school year? I'm going to let Mr. McIntosh speak. I'll say something, and then Jez, if you have anything to add. So Trinity compares its numbers with the local independent schools. So we've been very collaborative with the other 10 to 12 independent schools in the area. We certainly have looked at, the public school numbers and the community spread numbers. We have not compared our numbers to other schools that are mask optional. There are no independent schools that are mask optional in our area. There are schools in other parts of the state and country that are mask optional. I don't know the validity of that comparison and all the factors that would go into that, but mostly we are benchmarking against other independent schools and watching our community spread. Jez, do you want to add anything there?
Yeah, I would add, we have tracked but not compared. The state releases a cluster report every Tuesday and Friday. And last year and the beginning of this year, we would track that cluster report. And again, we didn't compare our numbers to those in Wake County, but we know that schools in the Raleigh area were mask optional, and there were schools that ended up on the cluster report. And to get on the cluster report for the state, you had to have 5 or more cases at one time that were linked together through exposure. So throughout the pandemic, we have never been on the cluster report or even close to be on the cluster report. So that's the only comparison that we've ever done. But it wasn't a school by school comparison or exact numbers. We just know we have never been on the cluster report, and we've seen schools down in other areas that don't have city or county mandates be on the cluster report.
Yeah, thanks. We also had questions about them. I'm sort of conflating a couple because I want to use our time the wisest way. Can you talk about if there's been COVID spread at school? Does the lack of campus transmission support the concept of going mask optional? But what do we know about transmission at school? And also the seriousness. Somebody asked a question about hospitalization or deaths among students, faculty, and Trinity community members. Jez, can you take that one too?
Yes. So for the first part, I think we were contact tracing up until Omicron, as Adia mentioned. The toolkit changed, and we, in the midst of Omicron, was not doing contact tracing. Your exposure and quarantine rules changed, and so up until December, we can confidently say there was no on-campus transmission of COVID when we were contact tracing. Once the guidelines shifted and we were no longer contact tracing, it's hard to say between the January time period of this year and now how many cases were here at school. We do know that the majority were due to home exposure, and so we would get a call if there was an exposure in the household, and then the student would test positive, or the faculty member. We do know, again, we've never been on the cluster report. We never had more than 5 in one classroom or a team, or have COVID at the same time, and so that's the only thing that we can say for exposure or connecting cases post January.
Great. And then just quickly, I think we thank God we've not had any deaths in the faculty, staff, or students. I think we have had some community members with, I suppose it's long COVID, some real challenges. So there are folks that have struggled and have been really sick, but we have not had deaths. And I can't speak to the hospitalizations. Here's Julie's clarification of her question, Harmony. Yes, as decisions are being made about masking, about making Trinity mask optional, is it reasonable to assume that the N95 masks are effective in helping to avoid contacting COVID, therefore allowing the community to determine their own risk level and whether to mask or not?
Great. Thanks, Julie, for clarifying that. So it's not, if I'm understanding correctly, it's not really a question of should Trinity be mask optional or mask mandated. It's if it's mask optional. Do we assume N95s are more effective? They're definitely more effective than the standard surgical mask or the cloth bandanas or whatever else people are wearing. So again, this isn't a conversation about making Trinity mask optional. But if they were to move in that direction, if parents were still concerned or worried about COVID transmission at school and wanted to have their children remain wearing masks, I definitely believe the N95 protects the wearer much more than a surgical mask.
No,
Or a cloth mask.
I think Harmony, she's asking if the N95s are so effective, then why should we be concerned if some people aren't wearing masks? Shouldn't we let parents make their own decision? Because the N95, for those who are concerned, if they can wear an N95, that would solve those who aren't wearing a mask.
Yeah, and I think that's, again, I'm happy to hear from other panelists, Julie. I think it's always, it's always so hard when we have these conversations. And I will say, it's probably fair to say the three panelist members here probably have our own personal opinions around masking and the utility of that. I think what's important to consider in these kind of decisions is the balance between, individuals and keeping individuals safe and protected, and the balance of taking the holistic care of the students in the school. And Trinity has always been trying to get that right, in terms of what do we need to do to keep our students and faculty safe and keep them in person. And on a personal note, I personally, I'm very thankful. I'm healthy. My kids are healthy. I don't have anyone in my direct circle who's immunocompromised or at risk, and we're all fully vaccinated, including boosted. So I'm pretty lax about wearing a mask. And if I had the option, I probably wouldn't choose to do so, just on a personal note. But I think what Trinity needs to also factor in is this isn't necessarily about every individual choice, because you can't accommodate every individual person at the school. And if you're looking at the school community, if kids get exposed, there's a quarantine requirement, right? And if you think about the community and say how many kids would end up having to be out of school for periods of time, I think that's something the school has to consider. And I do think, Julie, Chip, you might want to say more, or Jez, obviously with the new information today from Roy Cooper, I think we do need to wait and see if the policy itself at the school level can evolve, but obviously that's a very recent update to the decision today.
Yeah. And let me jump in. I want to take up one question myself that I think is really important that folks ask.
Can I add one
time.
thing to the mask question?
Yeah.
So N95s are not available for children. KN95s are. And then in order for an N95 or KN95 to work well, they need to fit properly and be on properly. And so that's a lot to ask. We know that in practice. So I think that's something to remember, that because the masks are available doesn't necessarily mean they'd be used well or it would be right for everyone at Trinity.
It's a really good point, Matt. Yeah.
Thanks, Matt. Let me speak real quickly, if I can, to this question or set of questions. Is the school required to follow Durham Health Department guidelines? How are we balancing their guidelines with those released by the CDC? Why has the school not left the decision about masking up to parents? So questions here about authority. What authority is Trinity under? What are we bound to? And these are complicated questions. I have been in communication with two attorneys this week, our school attorney and the attorney for the North Carolina Association of Independent Schools. We are legally bound by the mandates of Durham County as a school. Both of those attorneys agree with that. And so that's particularly the binding mandate that we have to pay attention to. The North Carolina Toolkit and the CDC are guidelines that we have adopted prudentially because we thought they were wise, good public health guidelines and have looked to those, but those are decisions that we had made. I think we're all hoping, well, I shouldn't say, I am hoping that the Durham County decision lines up with the toolkit when it comes out and is revised March the 7th, and that there won't be a discrepancy there. I think if there is that discrepancy, Trinity won't be the only institution that will be in something of a bind and a quandary there. So those are just a few thoughts there about that question. I'm going to grab two other questions real quick. We're getting towards the end of our time. One was about asthma, a question about can we, I'm not finding it on here, but it basically was, and Ivy, I'd love for you to take this.
Sure.
You know, can we say what the impact of masking for asthmatic children is
Sure.
and has
Sure.
been?
Sure. So, I mean, certainly there could be all sorts of arguments made to go mask optional. I'm not arguing one way or the other, but I can say with confidence that there have been studies looking at multiple parameters in children wearing masks while sitting and masks while walking, measuring heart rate, all sorts of vital signs, carbon dioxide, oxygen, which showed no difference. Masks did not cause any harm to those kids. And then also specifically to the asthma question, you know, the physiology of asthma is actually a lower airways disease that airways constrict in response to some sort of either allergen, toxin, it can be viral. And so not that I'm advocating for masks for asthmatic children, but you could almost argue that masks would be protective of asthmatic children because it's preventing them from inhaling those things. Again, there might be other downsides to masks in general, but that certainly I would not be, if you're a parent of an asthmatic child, I would rest assured that you are not causing any sort of long-term damage to their lungs or their health. So.
Great. Thank you, Ivy. Are there any of the panelists that want to make one last quick comment? I've got a wrap-up comment I want to make to close, but anything that you're burning to, you haven't had a chance to say?
I do actually, one thing, there is a question about different treatments, and I'm not going to get into specifics on treatments, but I think it's important to consider that the majority of our population is pediatric. And so, you know, medicines that are going to be approved in adults for COVID are going to take a long time to come down the pipeline for pediatrics. And even some medications that have been approved for emergency use in pediatrics, even when a child's admitted to the hospital with COVID, we still sort of second guess whether or not it's worth exposing them to that medicine that's not been studied in children. And so I think just keeping in mind that studies on medications to treat COVID in children are years down the road, and that the best option we have to protect our kids is the vaccine at this point.
Yeah, and I just wanted to also just say, you know, thank you for the thoughtful questions, because I think one of the things that I always think in these kind of situations where there's a lot of opinions, and as people have pointed out that the data is evolving and it can be confusing, is that we all are united that we love our children. We want to keep them safe. We want to be good community members. And I think, you know, trying to figure out what's best and still falling within the lines of what we know is the best available data. It may not be perfect, but what people are trying to do, I think, is something to consider. And I think, you know, just giving each other grace and remembering that we all want the best for our children and we're trying our best, I think is important in these conversations, and to be compassionate for those that are worried about things, compassionate to those who really are not ready to be unmasked, and just know that, you know, that I think that this requires for us to come together and still be together as a community, to remain compassionate and treat each other, continue to treat each other with respect with these things, and try to support our schools, because it is a really hard thing, and there's not always a perfect answer. And but I think these questions were really good, and glad that we were able to kind of talk through some of those.
Thank you, Adia. That's a wonderful wrap up there. We do have a number of questions we didn't get to. Carmen or Nate, if we could save the questions in the chat, and I don't know whether there's any chance we'll be able to get to any of the answers and send out an FAQ or something, but we might try. We'll see what we can do. There was one last question about if we go masking optional, what will happen when students return? I think this is the question. Would
I have it,
guidelines
Jim.
around COVID positive exposure be different based on students' vaccination status or choice to remain masked? Dr. Hall or Jez, could
I'll
you-
take that question. So, the question is, how are we going to treat exposures or positive cases if we go mask optional, once we go mask optional? And right now, the toolkit has already been updated and changed. And when we started the pandemic, there was distance and masking considered for exposure. And then it was vaccination status and distance, or vaccination status and masking was considered, and things we had to consider. Now for exposure in the pandemic, exposure, we are just looking at positive cases, the test positive or symptoms. There's no distinguishing between vaccinated or unvaccinated or masked or unmasked. If you test positive, you must go home for 5 days and wear a mask for 5 days afterwards. If you have symptoms, the COVID symptoms that Dr. Hall talked about, those are the only distinguishing factors now. So again, that's been a change since Omicron, and that was just updated on February 10th.
Yeah, thank you, Jez. So I just want to wrap up, first of all, by thanking our panel for being part of this. Really appreciate the time you've given in preparation for this and tonight. I want to thank our parents and others that have been on this call for your great questions. I'm sorry we couldn't get to all of them. And I just want to end by just, again, saying, we are one Trinity, and it's so important for us to hang together despite our differences. And there are differences. Yeah, we did the poll and about how comfortable are you with optional masking. And it was very bimodal. There are more people who are comfortable with unmasking. We said as early as March, which is interesting. We asked that question before the governor's announcement, and now he's announced that March 7th is when the toolkit will come out. But there's a sizable number of folks that they said one all the way to the other end of the scale. I am not comfortable unmasking. And, I'm not making a decision here, but I'm predicting that it's not a question of if Trinity will go mask optional. It's a question of when we will. And when we do, we have got to take care of one another. And, we've been in a period of time that some of us who have wanted us to be mask optional have been very frustrated. And we appreciate you speaking out about that. When we move into a phase where we're allow people to make that choice, there is another group of people that will have other concerns, and we've all got to take care of one another and work together. I think it's so important that we understand. The governor and the secretary today said they may wear masks in crowds. You may see me wearing a mask in crowds. People with no shaming for wearing masks. People may make decisions to wear masks for different reasons. We may, as a school, this is possible, we might go mask optional, but there could be a setting. I'm just saying, for example, if we wanted to get together for a worship time and we didn't feel safe doing it without masks, but felt safe doing it with masks, wouldn't that be a good option to do? So I just think we're going to need to be versatile, and we're going to need to customize this to the Trinity community. And so I do hope we can be gracious with one another as we move forward. We will try to communicate as clearly as we can, as early as we can, what we're doing and why we're doing it. And I know we're all longing to get back to normal. It will be a new normal. It won't be exactly the same old normal, but I hope soon it'll feel like a new normal that we all can thrive in. And I guess finally, I do want to say, we do want to give more emphasis to our mental health, the social emotional issues, and we'll be thinking about that. If you have ideas, if you're interested in a panel that would have mental health professionals on it for parents, I spoke with our TPO leaders today about that, and we're working to see if we could pull something like that together. So thank you for being here tonight, and really appreciate everyone's time. So with that, I'm going to close this, or actually, Jez, would you close us in prayer, please? I could ask you to do that. Thank you.
Dear Lord, we just come before you now. Thank you for your love. Thankful for your grace, your mercy, Lord. We thank you for the gift of salvation, the sacrifice of your Son, Lord. And we thank you for the opportunity to be here, to be at Trinity School. We thank you for these parents, our faculty and staff, and the partnership that we have with each other in delivering the mission of Trinity to educate students in TK through 12, Lord. And we do that for your glory, Lord. So I just pray now as we end this webinar and we have decisions to make going forward, that you continue to give us wisdom and discernment. And I just pray that for our students, that you continue to give them resilience and perseverance. And for those who are hurting, that you bring those, that we can show love to them and support. I pray for our teachers on this weekend, that they could have rest and restoration to come back stronger. I pray for our students and families that they have good quality time together, enjoying the small break, that we can come back from this break ready to go to make it to spring break, Lord. So we thank you for our panelists. We thank you for the time tonight together, and you just be with us as we go. In Jesus' name, amen.
Amen. Thank you so much, Jez, and thanks everyone. Take care.